Do you suffer from migraines? Or perhaps you have frequent headaches, but aren't sure whether they are migraines? You're not alone. The American Migraine Foundation estimates more than 39 million U.S. adults live with migraine, and the number may even be higher because many individuals, possibly even you, are not getting the diagnosis and treatment they need. The first thing to know is migraine isn't just a bad headache. It's a debilitating neurological disease that has unique symptoms, though not everyone experiences those symptoms in the same way. And migraine responds best to migraine-specific treatments. Migraine attacks have distinct phases, marked by symptoms beyond simply pain in the head. These varied symptoms range from irritability, fatigue, difficulty concentrating, sensitivity to light, dizziness, gastrointestinal issues, and effects on vision, including blurry vision, blind spots, flashing lights, the appearance of geometric patterns, or even vision loss. Not everyone who suffers from migraine experiences all phases. Yet, despite its prevalence, you might be surprised to learn that even today, researchers aren't quite sure what causes migraine, though both genetics and environmental factors seem to play a role. Scientists also suspect that imbalances in brain chemicals and neurotransmitters are involved, such as calcitonin gene-related peptide, or CGRP, which is shown to increase during migraine. Based on this, researchers have spent over 35 years investigating the role CGRP plays in migraine, which has led to new targeted therapies for migraine prevention, called monoclonal antibody CGRP inhibitors. While the science is complex, researchers have been able to create antibodies that are like the ones your body creates naturally as part of your body's immune system. These are known as monoclonal antibodies, or mAbs. During a migraine attack, CGRP causes the brain blood vessels to swell and sends pain signals to the brain. But these CGRP inhibitors, or CGRP mAbs, help prevent migraine by targeting the CGRP signaling pathway by blocking either the CGRP protein or the CGRP receptor. There are two types of migraine medications: acute and preventive drugs. Acute drugs are used on an as-needed schedule and are intended to relieve the pain and symptoms of an attack that is occurring or about to occur. Acute drugs are available as pills, nasal sprays, and injections. Preventive medications, which include several CGRP mAbs, are taken on a regular schedule, either daily, monthly, or every 3 months. They're intended to decrease the frequency, duration, and severity of attacks. Preventive medications are available as pills, self-administered injections into the skin, or an infusion into your vein administered at a healthcare office. So why are these CGRP mAbs important new additions in the fight to treat migraine? Well, up to 4 out of 10 patients with migraine continue to have unmet needs with their treatment. These unmet needs include ongoing pain burden, difficulty tolerating and adhering to treatments, and poor quality of life. When the goal is to prevent migraines, studies of CGRP mAbs showed a more favorable benefit-risk profile compared to older therapies. These results mean that it should be easier for you to tolerate and maintain CGRP mAb therapy compared to some of the older prevention therapies. The CGRP inhibitors also work faster to prevent migraines compared to older drugs, and you may start to see improvement over a few days or weeks. So, are CGRP mAbs right for you? If you suffer from migraine, it's important that you, number 1, find a healthcare provider who understands the complexity of migraine, and number 2, continue to talk to your healthcare provider about the goals of preventive therapy that work best for you, a process that is individualized but may require some trial and error. Remember, your participation in decision-making is critical. Not only will it ensure your treatment is working and that your lifestyle and quality of life are considered, but it will also help you adhere to your medications. Your ability to follow your agreed-upon treatment plan is one of the most important determinants of treatment success. So speak up and don't be afraid to share. Open the door to new possibilities and talk with your healthcare provider about the different CGRP mAbs to see which options are best for you.